going over whiplash of the neck today. You can have this from sports accidents, car accidents, falls, different things like that really just move the muscles and joints of the neck very quickly. Basically, you can injure the discs down here in the neck, which can sometimes cause aggravation of the nerves of the neck, which will cause pain down the arm or numbness and tingling. You can irritate these facet joints right here, or zygapophyseal joints. They become very inflamed, again tender, a lot of pain with motion. You can also strain the ligaments. So you have a lot of ligamentous support of the neck that goes from the different bones and helps to stabilize them and prevent excessive motion. You have them on the back, you have them on the sides, you actually have them in front as well. As well as that, you also have many muscles in the neck. So it's pretty crazy the amount of muscles that kind of pass each joint and help to stabilize and monitor the movement. Each one of these little tiny muscles can become injured, and part of getting that better is actually getting in there into that joint and restoring that mobility in the joint. These guys are so deep, they're really hard to massage. We're talking, good 2-3 inches deep there, that you'd have to get that thumb in there. So oftentimes moving the joint is one of the best things to do to heal that area up. The more superficial muscles will respond a lot better to kind of the manual therapies, but even the deep ones, stretching can kind of help get in there and loosen them up a little bit. As far as strengthening goes, we want to make sure we're really strengthening these deep stabilizing muscles in the front of the neck here. The scalene muscles in front can be big troublemakers. They basically go from the ribs up into the bones of the neck, and they're very closely associated with the nerves that go down into the arm. So when these muscles get too tight, you can get that numbness and tingling in your pinky and your ring finger. They can become very symptomatic. So working those muscles is very beneficial. So basically, as a chiropractor, that's what I do. I figure out which muscles are tight, figure out which muscles are weak, and I try and strengthen them up or loosen them up accordingly, depending on what they need. If you have a disc issue, chiropractic is beneficial for that as well.